So Turner syndrome is a non-inherited genetic disorder that is caused by either a complete or partial absence of one of the sex chromosomes in females. And it is considered the most common sex chromosome abnormality in females. Occurs 1 in 2,000 live female births, and in the United States there are about 70,000 females that are inflicted by this disease. Turner syndrome is usually diagnosed in preteen or older females, and the most common features are short stature and pubertal developmental delay. These are the most common features, but there are other features that have been described and are quite variable, and include the heart defects, major venous anomalies, as well as thyroid disease and kidney disease, as well as other features like learning abnormalities. Now, liver involvement in Turner disease has been described, and we know that from previous studies that liver test abnormalities are quite common. However, the exact nature of liver involvement in Turner syndrome hasn't been explored as extensively as other features of this disease, and this discrepancy, I think, is due to mainly two reasons. One is that, generally speaking, liver manifestations can be quite subtle up until advanced stages of disease, and also interrogating for liver disease entails undergoing invasive procedures, which many patients and their physicians are quite reluctant to pursue. So there's sort of a gap in knowledge in how extensive and what are the types of liver disease that can occur in this population, and the purpose of our study was to look into it, more thoroughly. At the poster that we're presenting at the AASLD, we describe a cohort of patients that were a cohort of patients with Turner syndrome that were followed for a course of several years at the National Institutes of Health. This is a large prospective natural history study launched by the NIH more or less a decade ago, led by Caroline Bondi and her group, looking into many aspects of Turner syndrome, and the study, the patients participating in the study underwent thorough clinical evaluation, including extensive lab work, metabolic testing, genetic phenotyping, and imaging with MRI of the heart and great vessels, as well as abdominal imaging and other sophisticated studies. We're at the liver disease group, liver disease branch, have a specific interest in the liver manifestations of systemic disorders such as Turner syndrome. So we followed these patients for evaluation of liver disease with lab testing and imaging studies, and in a subgroup of patients we also performed a liver biopsy. The main results, or the main findings of our study were that, as previously described in the literature, liver test abnormalities are quite common in this population. We diagnose 40 to 50% of patients with elevated liver enzymes, and depending on the specific indices measured. But more interesting was that liver test abnormalities were associated with other systemic manifestations of disease, especially vascular anomalies. Now, when looking into the specific subgroup of patients that had a liver biopsy, we found that for about 40% of patients had fat accumulation, which has also been described, but and generally attributed to the sort of systemic metabolic derangement that is typical of this syndrome. But in around quarter of the patients biopsied, we diagnosed a disorder called nodular regenerative hyperplasia, which is a disorder of vascular nature, which is quite rare in the general population, but again, in this specific cohort, it occurred in 25% of patients. And when looking at more specifically at the microarchitecture of the liver, we saw that a large proportion of these patients had missing vascular components like liver arteries or veins, and this finding was associated with vascular anomalies of the great vessels of the heart. So this is a very interesting finding, and I think it alludes to the fact that this vascular anomalies in the liver in patients with Turner syndrome are an organ-specific manifestation of a larger vascular developmental disorder that is probably linked to the genetic abnormality, and that in these patients that have been diagnosed with this disorder, they should be followed more closely. We still don't know the clinical significance of this finding, as most of the patients in this cohort were relatively young when we evaluated them, so we don't know what are the long-term implications of this finding. However, we know from other diseases that vascular abnormalities of the liver can develop into a clinically significant disease with end organ complications, including bleeding from varices and other complications. And this definitely suggests that patients with Turner syndrome should be interrogated for the presence of liver disease, and in those patients that are specifically diagnosed with vascular disorder, they should be followed closely and undergo surveillance for development of complications.